one of the things that people might not be aware of is that when you're coming into the dentist at a regular appointment, we're always looking for lots of different things. And one of the things we look at is how your child's teeth and jaw are growing and developing. And so we are now offering more orthodontic services, and we are doing more what we would say interceptive ortho. And interceptive ortho is when we are not necessarily doing brackets and wires to straighten teeth, but we're actually looking at helping the jaw to develop in a growing child and taking advantage of that growth period in their lives.
So we can start as early as the age of about 5 years old up until even adults, although it's easier when kids are younger because their bone is more easy to be able to move around to where we need it. But usually what we start with is, depending on exactly what they need, but our appliances that we put in their mouth. And then a lot of times if we need more expansion, you'll just turn the appliance a couple times during the week. It's usually a fairly quick process. Within 6 months to maybe a year, we'll get enough growth where their teeth are where their teeth will have more room once their permanent teeth start coming in. So we're really looking more at the jaw at this age than the actual teeth. Once they get all of their permanent teeth in, that's when we start trying to get their teeth in the correct position. But as long as we have enough room for that, it's a lot easier at that point. So in addition, besides just trying to get enough room for the permanent teeth, there's other benefits to expanding the jaw for children, and one would be to allow more room, particularly for their tongue position, and that allows their airway to open up. So if a child is really narrow, they actually will position their tongue in a forward position versus at the roof of their mouth, how it should be. So if we're able to expand that jaw, it allows their tongue to go to the roof of their mouth, and there's a lot of benefit to that. Besides just being able to sleep better, it also helps even with things such as their speech, and long term it's beneficial for them.
We know there can also be, if you have a narrower airway, that can lead to other problems. And so a lot of times in kids, we don't think about apnea, but that's becoming more and more common and more looked at these days. So ear, nose, and throat doctors, pediatricians are all realizing that good sleep is really important for growth and development in kids, and we all want kids to be able to do their best, I think. So some of the things that people look for, signs and symptoms, would be sort of like an allergic shiner, kind of like a little black and blue area underneath the eyes, irritability, hyperactivity, sometimes bedwetting can go along with that as well, difficulty in concentration, which, with kids it's so hard to sort through what's going on all the time. But if we know that there is a constriction in the airway, or we know that orthodontically something's going on, it's definitely a good place to start, and definitely a good thing to start exploring. So we are reaching out and working more with the pediatricians in the area, more with the sleep doctors in the area, and then also with the orthodontists too, so that it's kind of a multidisciplinary